Deep sexual health facts that shock everyone. 18. Sexual health is often treated as a taboo subject, yet it is an essential part of our overall well-being. Despite decades of research, there remain myths, misunderstandings, and surprising truths that most people never learn. Here's a deep dive into some sexual health facts that might genuinely shock you. The brain is often overlooked in discussions about sexual health, yet it is arguably the most critical organ involved in sexual functioning. While most people focus on physical aspects, such as genital anatomy or hormone levels, sexual desire, arousal, and satisfaction are largely orchestrated by the brain. Neurotransmitters, chemical messengers, like dopamine, oxytocin, serotonin, and norepinephrine, play a central role in regulating sexual behavior and emotional response. Dopamine, for instance, is directly linked to the reward and pleasure systems in the brain, influencing not only sexual desire, but also motivation to seek intimacy and connection. Oxytocin, sometimes called the bonding hormone, is released during sexual activity and orgasm, creating a sense of closeness and emotional attachment between partners. These chemical processes demonstrate that sexual health is inseparable from mental and emotional well-being, emphasizing that stress, anxiety, depression, or other psychological factors can have a profound impact on sexual experiences. Beyond neurotransmitters, the brain integrates multiple sensory inputs that affect arousal, from visual and auditory stimuli to touch and smell. The limbic system, particularly areas such as the amygdala and hypothalamus, is heavily involved in emotional responses and sexual motivation. When the brain perceives safety, comfort, and desire, it triggers physiological responses such as increased blood flow to sexual organs, heightened sensitivity, and hormonal changes, which are essential for arousal and orgasm. Conversely, if the brain senses danger, stress, or emotional detachment, these physical responses can be inhibited, making it difficult to achieve sexual satisfaction regardless of physical stimulation. Mental imagery, fantasies, and anticipation also play a crucial role in sexual response, illustrating that desire is often a cognitive phenomenon as much as a physical one. This connection explains why individuals with strong mental focus, imagination, or emotional intimacy with their partners may experience more intense or fulfilling sexual experiences. Furthermore, disruptions in mental health, such as chronic stress or trauma, can alter neurotransmitter balance, reduce libido, and interfere with orgasmic function, highlighting the importance of addressing psychological factors alongside physical health. In essence, understanding sexual health requires recognizing the brain as the central command center that integrates emotion, cognition, and physiology, and realizing that nurturing mental well-being is just as important as physical care for a satisfying and healthy sexual life. Sexually transmitted infections, or STIs, are often misunderstood because many of them do not produce obvious symptoms, yet they can have serious long-term consequences if left untreated. Infections such as chlamydia, gonorrhea, human papillomavirus, HPV, and HIV can remain silent for months or even years, allowing the infection to progress unnoticed. This asymptomatic nature makes regular testing essential, even for individuals who feel healthy and believe they are not at risk. Chlamydia, for example, is one of the most common STIs worldwide and often presents no symptoms, but it can cause pelvic inflammatory disease in women, leading to infertility if untreated. Similarly, untreated gonorrhea can result in severe reproductive complications, including chronic pain, inflammation, and damage to the reproductive organs. HPV is another STI that frequently goes undetected because it often shows no immediate signs, yet it is a leading cause of cervical cancer in women and can also affect men through genital or throat cancers. Vaccination programs have helped reduce the prevalence of certain high-risk strains, But consistent screening remains vital, because the virus can persist silently for years before causing noticeable health problems. HIV, while more widely recognized, also presents in its early stages without significant symptoms, which can delay diagnosis and treatment. Without early intervention, the virus gradually weakens the immune system, leaving the body vulnerable to life-threatening infections and complications. The fact that STIs can be silent emphasizes the importance of protection and preventive measures. Consistent use of condoms significantly reduces the risk of transmission for most infections, though some viruses, like HPV and herpes, can still be spread through skin-to-skin contact in areas not covered by a condom. Open and honest communication with sexual partners about STI status, history, and testing routines is equally crucial, as it allows for informed decisions and safer sexual practices. Another aspect often overlooked is that STIs are not limited to casual encounters. They can occur in long-term relationships if partners are not regularly tested, or if prior infections go undetected. Education, regular screenings, and preventive strategies, like vaccination and barrier methods, are critical to reducing the hidden burden of these infections. Understanding that sexual health involves proactive management, not just reactive treatment, helps individuals maintain long-term reproductive and overall health, even when no symptoms are present. Sexual activity is often viewed primarily as a source of pleasure or intimacy, but it also has profound effects on physical and emotional health. Consensual sexual activity triggers a cascade of physiological responses that benefit the body in multiple ways. During sexual arousal and orgasm, the brain releases neurotransmitters such as dopamine and oxytocin, which not only enhance feelings of pleasure and emotional bonding, but also reduce stress and promote relaxation. This natural stress relief can have downstream effects on overall health, as chronic stress is linked to heart disease, weakened immunity, and hormonal imbalances. Cardiovascular health, for example, can improve through regular sexual activity. The increased heart rate and blood circulation that occur during sexual arousal and intercourse functions similarly to moderate exercise, helping maintain cardiovascular fitness. Studies have even suggested that individuals who engage in regular sexual activity may have a lower risk of heart disease and stroke compared to those who are sexually inactive. The physical exertion, combined with the release of endorphins, contributes to overall well-being and can improve mood, while reducing feelings of anxiety and depression. Immune function is another area positively influenced by sexual activity. Engaging in sex has been associated with higher levels of certain antibodies, such as immunoglobulin, IgA, which plays a key role in defending the body against infections. This suggests that a healthy sexual life may provide subtle but meaningful boosts to the body's natural defenses, helping reduce the frequency or severity of common illnesses, such as colds and flu. Sleep quality can also benefit from sexual activity. The release of oxytocin and prolactin during orgasm promotes relaxation and helps regulate sleep cycles. This can lead to deeper, more restorative sleep, which in turn supports mental clarity, emotional balance, and overall physical health. Beyond the physiological effects, sexual activity enhances emotional intimacy and social connection. Partners who maintain a healthy sexual relationship often experience stronger bonds, higher relationship satisfaction, and improved communication, all of which contribute to emotional resilience and psychological well-being. These combined effects illustrate that sexual health is inseparable from general health. A fulfilling sexual life is not merely a luxury, but a contributor to physical fitness, immune strength, stress management, and emotional stability. Understanding the holistic benefits of sexual activity encourages individuals to view sexual well-being as an integral part of a healthy lifestyle, rather than an isolated or purely recreational activity. Communication is one of the most critical yet often overlooked aspects of sexual health. influencing not only satisfaction, but also safety and long-term well-being. Open, honest conversations between partners about desires, boundaries, and concerns create a foundation of trust that enhances both emotional intimacy and physical experiences. Many sexual issues, ranging from mismatched libido to difficulties with arousal or orgasm, can be traced not to physical problems alone, but to a lack of clear communication. Discussing preferences, expectations, and any anxieties before or during sexual activity allows partners to navigate differences in a respectful, empathetic manner, reducing misunderstandings and frustration. Consent is a central component of healthy sexual communication. Explicitly expressing and respecting boundaries ensures that all parties feel safe and respected, which is essential for both emotional comfort and physical response. When consent is clear, the brain can fully engage in sexual arousal and pleasure, reinforcing the neurological pathways that contribute to satisfaction. Conversely, situations where boundaries are unclear or ignored can create stress, anxiety, or trauma responses that inhibit sexual function and damage trust between partners. Communication also extends to discussing sexual health proactively. Talking openly about STI testing, contraception, and medical histories is crucial for reducing risks and fostering a culture of shared responsibility. Many individuals avoid these conversations out of fear of judgment or embarrassment, but framing them as acts of care for oneself and one's partner can normalize these essential discussions. Regularly revisiting these topics as relationships evolve ensures that both partners remain informed and protected. Even in long-term monogamous relationships, emotional literacy plays a significant role in effective sexual communication. Being able to articulate feelings, desires, and insecurities with clarity helps prevent resentment and misunderstandings, creating a feedback loop that strengthens both sexual and emotional intimacy. Active listening, truly paying attention to a partner's responses without judgment, is equally important, as it validates their experience and fosters mutual understanding. Couples who prioritize this level of communication often report higher sexual satisfaction, greater relationship stability, and an enhanced sense of partnership. Ultimately, sexual health is not solely a biological or mechanical process. It is deeply intertwined with interpersonal dynamics and emotional intelligence. Prioritizing communication equips individuals and couples to navigate challenges, address needs, and maintain safe, fulfilling sexual relationships. By fostering openness, respect, and honesty, partners can transform sexual experiences into opportunities for deeper connection, mutual growth, and long-term health. Understanding sexual health requires more than just knowing the anatomy or practicing safe sex. It involves nurturing the mind, body, and relationships. By recognizing the brain's central role in desire, staying vigilant about silent infections, embracing the physical and emotional benefits of sexual activity, and prioritizing honest communication, individuals can cultivate a healthier, more fulfilling sexual life. Sexual well-being is not a luxury but a vital aspect of overall health, and approaching it with knowledge, openness, and care empowers people to make informed choices, strengthen intimacy, and enjoy a more satisfying, connected life.